Hello, I'm Aileen O'Brien. I'm a reader in psychiatry at St George's University of London. Today I'm going to talk about self-harm and suicide. So the learning objectives for this session are to define self-harm and suicide, what we mean by the terms, describe risk factors, describe the assessment and management of patients who self-harm, and to talk a bit more globally about what we can do to try and reduce the incidence of both self-harm and suicide. So what's self-harm? NICE define self-harm as intentional self-poisoning or self-injury, irrespective of the apparent purpose of the act. And it can take various forms. The most common would be cutting and self-poisoning, overdoses. But you do see less commonly people who burn themselves, typically with cigarettes, people who bloodlet, insert foreign objects into their body, bang their head, other more unusual types of self-harm. And there's a lot of concern globally and in Europe and UK especially about the fact that self-harm seems to be on the rise. You can see that headline that in the NHS, self-harm has been said to have risen by 56% in a recent study. And those are a few quotes from people who have self-harmed in the past, trying to explain the rationale behind it or why they did it. It's important to stress that self-harm by itself is not a diagnosis, it's a behaviour. And although it's usually in clinical practice related to mental illness or at the least distress, people can harm themselves for other reasons: religious rights, social protest, political protest. The terms involved in self-harm include DSH, deliberate self-harm, as mentioned before. Other terms you might hear: intentional self-harm, parasuicide, attempted suicide, non-fatal suicidal behaviour, self-inflicted violence. And there is, sometimes at least, I think people try to differentiate between acts where the self-harm was intended to do just that, harm yourself, or acts where the intention was suicide and it wasn't successful. Although, as I said in the first slide, that is not a way that NICE differentiate the term. They just say self-harm is self-harm.